Hello and welcome to Strong Talk, a podcast dedicated to the discussion of equity, diversity, and family as it relates to mental health and addictions. A space not only to talk about challenges, but to explore and create space for solutions. I'm your host, Vic Armstrong, and I want to thank you all for joining me on this journey. My guest today joins us from Cameroon, Africa. He's none other than Dr. François Tchidjé. Dr. Tchidjé is a certified leadership coach, pastor, author, and speaker based in Cameroon. And he is the CEO of Soul Shop Africa. He is deeply committed to suicide prevention. His mission is to equip faith communities, mental health professionals, and community leaders with the necessary tools to address the mental health challenges across the continent. He holds a doctorate in transformational leadership from Harvard Christian University International. And Francois is also the founder and president of Compassion, an organization dedicated to providing spiritual and therapeutic support to vulnerable populations. Additionally, he serves as an anti-drug therapeutic counselor and leads MILIS International, a global organization operating in 6 countries across 3 continents. Welcome, Dr. Tchidjé.
Thank you, Vic, and I greet all those who are watching us on this podcast. Thank you for inviting me.
Well, thank you so much for joining us. I know getting the schedules aligned is a little bit of a task because you have a 6-hour time difference. So we greatly appreciate you joining us. I do want to give people just a little bit of background on how we got to this point, because I know folks can be wondering, what is the connection between American Foundation for Suicide Prevention and Cameroon, Africa? Well, back in January of 2022, AFSP partnered with Soul Shop Movement to convene a group of mental health experts with expertise in suicide prevention and connection to the Black and African American faith-based community. The group encompassed lived experience, research, policy, and pastoral experience. And the result was creation of Soul Shop for Black churches, an 8-hour curriculum that teaches faith leaders in the Black community how to minister to congregants who may be experiencing suicidal desperation. Since its inception, Soul Shop for Black churches has trained faith leaders across America, including a training in Asheville, North Carolina in October of 2023, which was attended by Dr. Tchidjé, who traveled from Cameroon, Africa to participate. Returning to Africa, Dr. Tchidjé began conducting training on his own, but recognized the need for additional trainers. So in response, I, along with Soul Shop CEO Michelle Snyder, joined Dr. Tchidjé in Cameroon, where we spent 6 days on the ground training 92 faith leaders in suicide prevention. And I have to say, it was one of the most rewarding experiences of my life.
Soul Shop hasn't done our job unless people leave here and work to transform their communities.
I think one of the biggest things that we have to deal with is people understanding suicide. We fear things that we don't understand. So what happens around the world is that we don't talk about it, we don't acknowledge it. The beginning of understanding is really allowing ourselves to accept that it's real.
Partant du Cameroun, nous voulons agir de manière à ce que dans les 10 ans, 15 ans à venir, qu'il y ait partout où on trouve 5 personnes, qu'il y ait au moins une personne qui soit formée, équipée comme sentinelle en matière de prévention du suicide et qui puisse donc sauver des vies.
So I want to start, do you mind if I call you Francois?
It's okay.
So I want to start, Francois, with a little bit of background on how you decided that a program here in America, Soul Shop for Black churches, how did you decide it was something that you need to get involved in that made you travel all the way from Cameroon, Africa, to be trained in this program?
Yeah, that's interesting. I, as a pastor, I've been, counseling people on a daily basis, and I've come across people struggling with suicidal thoughts and trying to use, Bible verses, encourage them for prayers and stuff like that. I could imagine that I needed a specific training for that. Sometimes I was successful, sometimes not, but I just thought that was normal. That's how it goes.
Mm-hmm, mm-hmm.
But when I met Michelle Snyder, and she was sharing about a pastor who actually wrote to the Soul Shop office in America from Africa, and we wanted to be trained. And she was worried because the pastor could not afford to come to America for the training. And so that was a problem. So I said, maybe I can do something about this. Maybe if we have a training, if I am trained and we organize a training in Cameroon, the pastor may fly to Cameroon, which would be much more cheaper than to fly to America. So I was then, therefore, I was invited to come to the training in America. And during the training, I was shocked when I had to prepare my own presentation. I was trying to get statistics about Africa and about Cameroon. And I was shocked to discover that Cameroon was ranked the 5th country in Africa with the highest suicide rate and the 96th country in the world. And I was like, I've been living in Cameroon. How can this be possible? So I started to put together some more information and discovered this was true. This was real. And even those statistics will actually not be that accurate because gathering enough information in Cameroon concerning suicide would be difficult. Because it still goes with a lot of stigma and nobody wants to talk about it. So that which was just a training to help some pastor in Africa to get trained become a personal burden. I discovered that there was need to get more involved in Cameroon and in Africa and equipping faith leaders to be able to respond to this struggle in people's life.
Yeah, it's interesting because when you talk about not being aware of the rate of suicide in Cameroon and as a faith leader, you're charged with overseeing people's lives, but really hadn't thought about the mental health and suicide part of that. And it really hits home with me because we experience the same thing here in America. That's one of the reasons that we started the Soul Shop for Black churches training here in America, in part because we recognize that there is a need for training that is culturally relevant. There's a need for training that's relatable to the lived experience of the communities that we're trying to speak with. And part of the reason for that is it helps to make it relevant to that community, embedding statistics that reflect the impact on that community, talking about the challenges that are unique to that community is something that we found helpful in trying to reach historically marginalized communities. So when you talk about that lack of understanding around the impact of suicide in your community, we come across that all the time here with the faith leaders we work with here. The other thing that was really interesting about what you just shared when you talked about the stats is one of the things that was astonishing to me is during the time that I was there, and we talked a little bit about this, I think on the last day or so before we left, but there were 4 reported suicides just in the less than 2-week span that I was there. And I say 4 reported because that's 4 that we knew about. And if there's 4 that we knew about, you can only imagine how many other suicides take place. And I mean, think about that. We're there on the ground for less than 2 weeks. And just in our circle, there are 4 suicides that we know of. So we know there's a need for this kind of training.
Yeah, the need is great. I think that with the coming of social media and ease to use internet, more and more information can quickly be gotten when people, die by suicide. But in our culture, in most African culture, suicide is looked at as something which is related to witchcraft, sorcery. So when somebody dies by suicide, people assume either he was, possessed by a demon, or he was cursed by God or by someone else. Nobody wants to talk about it. Nobody wants to associate with it. And people don't want the information to go out because if it's, for instance, a family where there are ladies who are hoping to get married later, they think that nobody will want to come and marry a girl from a family where there is a curse or there's witchcraft going on. So that's one of the challenges. And I believe that as we're doing the training, more and more people are getting aware that that's not the case. It's not something about witchcraft, not something about, sorcery. And I believe that more and more tongues now are unleashing to be able to share and to talk about, the struggle and even about the suicide itself. Less than 2 days ago, we had another reported case. And since the training, we have a WhatsApp group where people are sharing, those who have been trained are sharing. It's like almost on a daily basis, you hear 3, 4, 5 cases of suicide going on, and the awareness is growing among themselves. And the last 2 weeks, there were so many sensitization campaigns that were organized all around the country by people who got trained, because the awareness is growing with them, and they feel the need to reach out to other people and create that awareness around.
Yeah. And that's kind of, I guess, we have a phrase called a double-edged sword. And I think the double-edged sword here is that on the one hand, it is great. People are more aware. But the challenge is once you become aware, it really opens up your thinking, because you've lived the bulk of your life not even thinking about the fact that people are dying by suicide. And now that you recognize that, you do feel this sense of urgency to do something about it. But the beauty is that now that you are aware, you're better equipped to do something about it, to address it. The beauty of this Soul Shop training is, and we make it very clear, we're not training faith leaders to be clinicians. We're not trying to make them psychiatrists or psychologists or social workers. Yeah. But we are recognizing that faith leaders oftentimes are going to be the first point of contact for someone who is struggling with suicidal desperation. Either they may be having suicidal thoughts themselves, they may have lost someone to suicide, they may be a past suicide attempt survivor, or they may be concerned about someone else who's thinking of suicide. You have all these people sitting in your congregations every day. And so it is important that we have people to be equipped to be able to minister to those folks when they are hurting and in pain.
Yeah, that's so true. That's so true. I remember this lady, Nancy from Douala. She was among those who were trained as suicide prevention agent. And she said she went back and talked to her pastor about the training she just went through. And the pastor said, why wouldn't you just share a few minutes after church service with the whole congregation? So she had a few minutes after church service to share with the congregation. And then she called me on the phone and said, I don't know what to do next. I said, what's happening? She said she has more than 90 people who are writing to her inbox and said, I want us to talk about, because I've been struggling with these thoughts and I didn't know who to talk to. But from listening to what you said today, I feel I can talk to you. So we had to tell her, wow. So we said, we will have you mobilize other suicide prevention agents in your city so you can meet and discuss on how you can, organize to connect with all these people and discuss with them. So it's so true that, when somebody's thinking about suicides, he can talk here. He can talk to the father, to the mother, to the family member. But most of the things that we can't say to anybody, we might be more willing to tell it to a priest or to a pastor. Trusting that with the pastoral secret, he will keep it. But we're also ready to talk to the pastor or to the priest, because we believe he can say a word or a prayer or something that can help.
Right.
So equipping faith leaders is actually it's very strategic, because those are the people most people will go to. And the church is a place where most of those people will go to, even if they don't want to talk about it. They think they will go there through the singing, the music, the preaching, they will get some comfort. And so equipping faith leaders and making them ready to openly talk about suicides is actually strategic to reaching out to those people that will most likely come to church and go nowhere else.
Absolutely. And that's one of the things that is not unique to any one culture. The thing about it is it so happens in the Black community here, and it happens in your community in Cameroon, that the voice of the faith leader is a trusted voice. That's a trusted messenger that people want to talk to when they're experiencing pain. And so it's important for us to have that trusted voice, to be equipped with the right information, the right messages when people come to them. But the thing that is not unique is that whenever people are hurting, whenever people are struggling, and we talk about this in the Soul Shop training, what people lack is hope and social connection. And that's something that's universal. That's not something that's unique to America or to Africa. People need social connection. They need to connect with other people. And it's difficult to connect with other people when you're being labeled as a moral failure, when you're being labeled as having spiritual weakness, when you're being labeled as an outcast because you don't really fit the mold of what people think a healthy Christian or a healthy community member should look like. And so having that outlet is so important.
Yeah, and it's commonly said here that actually suicide is what people problem is. So
yeah.
It's commonly said. So when I was growing up and we heard that somebody died by suicide, it was like, why is he pretending to be a white man?
Mm-hmm.
What crosses his mind to think about, about that? So till today, even those who might want to talk about it are, kind of scared to be looked upon as if they're not fitting in the culture. Yeah. So.
Yeah. And again, I mean, we experience the same thing. I talk with folks, and it's gotten better, but I talk with folks here in Black and brown communities, whether I'm talking with, Black or African-American people, when I'm talking with Hispanic people, oftentimes what they will share is that they have always been taught that suicide was a problem for the white community. It was not something that impacted the Black community. Now, I have some thoughts on partly why that exists, because when we think about whether it's in America or whether it's in Africa, when we think about stigma, and stigma being so heavy in the Black community, there's a reason that stigma exists. Stigma is a narrative that a community forms, but oftentimes it's a narrative that's formed as a coping mechanism, or it fills a void when there's no other resources, no other answers for what's happening or why it's happening. People fill that void, and it gets filled with misinformation in the form of stigma. And so it's really important for us to recognize that if we're going to break down that stigma, we're going to have to normalize the conversation. We're going to have to create opportunities to talk about it. And what better place to start than with that faith-based community where people are going to be going anyway and looking for answers and looking for hope.
Yeah. And I fully agree with that. I think in our area, one of the challenges is that when we're training faith leaders to help the congregation or just the community with the struggle with suicide, one of the biggest challenge here is you may help the person escape suicide, but he's just struggling with his mental issues. So for a full care, he needs to be led to a professional. But now, Cameroon, for instance, has about 28 million people. And we learned during the training from one of the psychiatrists who was there that there are only 18 psychiatrists for 27 million people. So 28 million people. So there is still a need to the need to equip the faith leaders to help those who are struggling with suicide. But there is a need to, I don't know if it's to get more resources or to equip more psychiatrists. That's some of the things we are actually reflecting on. How we can influence the authorities, our government, to pay more attention to mental struggle, and then to increase maybe the number of psychiatrists or number of training centers for psychiatrists, or recruit more of them in public hospitals so that it can be easy for those who are struggling, who have been helped out of a suicide maybe crisis, to easily get access to professional resources.
Yeah,
I don't know how it works in America, but that's a big issue here.
It's an issue here too. I think part of what can happen though is that, the more that you have people in the communities asking for resources, demanding resources, the more pressure there is to provide those resources. And if what people have been saying for decades is it's not our problem, it doesn't impact us, there is no pressure on other organizations to reach into your community to give you those resources. I think part of what's happening now is you're developing more recognition around the fact that these suicidal challenges exist, and that you do need more resources to impact it. I will tell you this: one of the things that struck me about the training in Cameroon is that, and this is one of the things that I think was a little bit different, in a good way though. When I think about a lot of the training we do here for for churches? I mean, first of all, we introduced the idea of Soul Shop for Black churches in Africa. I know the first response was, what's a Black church? There's just church. No Black church, white church. There's just church. But the more we talk about introducing the church as a resource to speak to that, what we find is that there is a desire, there is a need. There are people who are looking for those resources. There are people who are searching for those resources. But oftentimes, when they go to the faith leader, when they go to the church, what they are told is you just need to pray harder. They're told that you just need more faith. You need to be a better Christian. What that often does to them is it tells them the problem is with me, that I'm not doing enough, that I need to do more. And that can be discouraging to people. But I think the more that people understand that, to my point about pressuring the government, I think the more that people understand that there are resources out there to help, then the more that we can rally around those resources. Your folks in Cameroon, when we talked about the power or the ability of the church to address these issues, in America, oftentimes we are talking to churches who are looking at what can my church do, or what can our couple of churches in our denomination do to address the challenges in our community. When we had the conversation in Cameroon, your folks came to it more like we are the community. It is not just for a church or a handful of churches. It is about healing the whole community. That was a little bit of a different mindset, I think. But I also think it really helped them to wrap their minds around exactly what you're talking about there are not other resources out here. In America, I can train people and I can say, okay, now direct them to the AFSP website. Now direct them to Mental Health America. You don't have those resources there. I can send them to a psychiatrist here. I can send them to a clinical social worker. Your folks had to come to this and say, I might be the only resource this person has. Yeah. A lot of responsibility, but to me, it was just awesome to witness them wanting to take on that responsibility. That this is about helping my brother, helping my sister, but we do need to get them help. We need to get more resources in their hands on the ground.
Yeah, that's just so true. It's the struggle is not new. What is new is the awareness around it. Now that we're getting aware, we want to get into action and do something. But as you said, the resources are limited. We're so grateful for the social training that we got. But we still find out that after talking with the person, after helping the person out of the crisis, he still knows he needs to more follow up. Mm-hmm. We don't have enough psychiatrists. I had to, look around at the AFSP website and I see you have resources. It's like you almost got every resources for every aspect, every step, and all of that. And I was like, how can these resources? How can this get to Africa? How can this get around us? It's good for sensitization, good for short trainings, for opening discussion, small group, in young adults group, and all of that. So like, I was talking jokingly to a friend, said, talking about the AFSP website. I'm saying they have all these resources there, and we need all these resources here. And then we are ready to get into action, and these resources are standing on the website. I was like, okay. I hope that so many people are actually getting on the website and getting the resources. But it was a way of saying that we need this so much. And this is actually there. Most people who are struggling will not actually go to the AFSP website, but we can get the resources out of the website and get into action. Last week we spoke in a school to about 3,000 students in high school. So the principal of the high school gathered all of the students and gave us to talk to them. So we talked to them, and we were like, we wish we had the resources after talking or while talking, sharing with them, and being able to follow up with some conversations with them. So it will take time to build our own resources because we also are still learning about that. We will maybe have to work with the psychiatrists and see what is to be done and all of that. But if we had some resources available which are ready from the experience you guys already have, it will be very useful to start doing the work with and maybe to adapt as we go on.
Yeah, and I think that's a conversation that we'll continue to have. How can we support you there, making sure that you have access to resources? Some of it may be are the things that we can help to translate, or resources we have that can be translated into French that you can utilize there. So those are conversations, again, that we'll continue to have, and they'll continue to develop. I know that part of your platform, part of your way of thinking about this is really to transcend geographical boundaries. I know even in thinking about the work in Africa, we trained in Cameroon, but I know you're already thinking about Ghana and Nigeria. You're already thinking actually about even countries on other continents where you have connections. And I think that's so important, because suicide around the world, somebody dies by suicide every 40 seconds. It's not isolated to any one country. And I think the more that we can think about it globally, and the more that we can reach across continents and countries, the better we're going to be equipped to battle suicide.
Yeah, because though we may have a geographic, boundaries, humanity actually does not have any boundary.
Right.
And we interact all the time in different ways, in movies and all of that. So what's actually happening in America is happening in Africa in one way or the other, or is affecting Africa directly. Now, if we are thinking about, okay, we're working on this geographical boundary, it's not true. I mean, it might look like, but actually what is happening is actually going beyond that boundary. So if we think as humanity, one of the targets we have in Africa, I mean, as the social director for Africa, I said, I want that we can actually shift the whole culture in Africa concerning the way people look and talk about the mental health issues. And we set the goal that in the next 10 years, we want to get into the point that for every 5 people that gather somewhere, there's at least one person who is trained to intervene in a mental crisis. So to reach that objective, actually, I need to think beyond Cameroon. If people in Cameroon are aware about suicide and are having a good conversation and are working to make Cameroon a so safe community, but those who are in Gabon, which is a nearby country, in Chad, who are entering out and in and out Cameroon all the time, if there's no awareness there, Cameroon still has a problem.
Right. That's right.
If my neighbor is not aware, and if I'm aware and my neighbor is not aware, I'm still in trouble.
Yeah, absolutely.
Because I could be,
I mean, even think about, I would not have, when I was in New York in 2022, as a part of the group that was thinking about this program called Soul Shop Africa. I'm sorry, Soul Shop for Black Churches. I never would have anticipated that we would be sharing this program in Africa. And so you think about, first of all, that suicide prevention work transcends boundaries. And so when you think about people needing hope and social connection, that is not something unique to any one space. So the principles around suicide prevention are principles that you can share. You may need to change some things to adapt it to the culture.
Some examples, some illustrations,
But the principles are the same. I remember when we were doing the training in Africa, and we have a slide where we talk about, we go through all the different, what we call the 6 S's of suicide. And we talk about, when we address all these things, shame and sickness and all these kind of things, that we become not just hope, but we become hope with skin on. And so when I share that in America, people get a visual of what it means to embody hope. When I initially shared it with the group there in Africa, they didn't initially get what hope with skin on means. But I remember I said to them, it means hope is not an idea. We are the hope. And it was like a light bulb came on. They made and I think you actually posted on social media. They took that.
We put it on a T-shirt. We're making T-shirt with that on.
Oh, fantastic! But that's it. Yeah. It was, but again, it's like you may have to change the wording just a little bit to make it fit the culture. but the idea is the same. We are the hope. We're the hope that people need. And if we can equip other people to be able to talk about this and to be able to help people who are struggling, that's the way that we end suicide.
Yeah. It's just so true. I came to America and I got trained in America. I wasn't like lost during the training. I understand all the examples that were mentioned, all the explanations, because actually it's the same everywhere. It's the same struggle. It's dealing with human beings, and so the context, man, we may need to put in a context. We need to do this. I remember during the training in America when I shared my story, how I almost got drowned in water in a seaside in Kribi in Cameroon. Yeah, everybody in the hall was almost crying. But when I shared the same story in Cameroon while I was doing the training, everybody just laughed. They just laughed But the bottom line is, whether in America where they might be crying about the story or here where they seem to be laughing, the bottom line is the suffering behind it is perceived. And by the end of the training here in Cameroon, the same story will not have made the people laugh. We laugh sometimes over things that we are struggling with because we don't want to face the reality of the thing. Laughing is a way to escape. But when we go beyond the laughing by sensitizing, by explaining, people can face the suffering, the sorrow, the struggles behind, and they're ready to go about it. And people seem to not want to face their sufferings or their strugglings because they don't know how to deal with it. Now, if we have resources to tell them this can be dealt with, there's a way to understand, there's a way to go about this, then people are ready to, face those things with boldness, with courage.
Yeah, absolutely. I can't tell you what it meant to me to be in Africa and, to see logo that has AFSP alongside Compassion and to see that the work that we are doing here is impacting lives in Africa. We find ourselves right now at a place where, here in America, because we've gone through changes with our political structure, political administration, and so people are still trying to figure out what that means. What does it mean in terms of access to resources? What change are we going to be impacted by? But one of the things that encourages me is that looking at the example of what we've done here with AFSP and Soul Shop Africa, it tells me that at the end of the day, it's not about what the government does. It's not about what an administration does. It's about what we do, how we can connect to support each other, how we can reach across, whether it's party lines, whether it's country lines, whether it's continental lines, whether it's denominational lines. How can we reach across and support one another in this work? Because at the end of the day, that is what is going to make the difference. And I am curious, you've got 92 freshly trained faith leaders over there in Cameroon, Africa. What's the plan? What are you going to do with them?
That's a good question. On one side, I have what I'm thinking about, but we actually had to sit and discuss with them on what we can do. Yeah. And then we have, in those 92 people, we have 31 of them who have been trained as trainers.
Right. Yep.
Whose mission is basically to help train more suicide prevention agents. Mm-hmm. So we are planning a kind of, I wouldn't call it a master class, but a discussion that will be next Tuesday on how we can present the need for such training in different organizations, settings, and even churches in Cameroon. Yeah. Right after the training, you remember during the graduation ceremony, we had people from almost all the ministerial departments.
Yes.
Yeah, all those authorities around. And one of them called me a few days after and invited me over to her office. She was the director of social affairs and stuff like that for the Yaoundé Council. Yaoundé is the political capital of Cameroon. It's one of the biggest cities. And we actually discussed to organize a training for the staff of the council. That is 25 people to go through the training, and the council is supposed to pay for it. She understood the need for the people, her colleague in the council, to go through the training. That's the kind of thing we are thinking about, how we can approach, companies, churches, organizations, and propose to train their members, their staff. But on the other side, the suicide prevention agent who have been trained, we encouraged them, we told them, we had a meeting and discussed about the fact that they have been first been trained to be like, invigilators, to be like people watching over the people around them. Mm-hmm. So it's not first about making programs, sensitization programs and big programs. It's about keeping to the commitment that we took during the training to watch over ourselves and to watch over those around us. Yeah. Then now we can take any opportunity that's available to us to reach out to other people. But let's not be so focused on making programs, sensitization programs, that we forget to watch over ourselves and the people around us. And we believe that we organize them in teams. And in the 3 main cities in Cameroon, we have those teams working together and planning what they can do at different moments, but also staying together to build themselves and to prepare other people to be trained as suicide prevention agent. Because as we said, for every 5 people, there must be 1 people, so that the small community would be a soul-safe community.
Absolutely. I love it. I love your vision. I love your passion around this. And I am so happy that we at AFSP had an opportunity to play a small part in that. And I look forward to seeing your progress there. And actually, I look forward to someday making a trip back over there and hopefully doing some more training with you guys in Africa.
You're welcome.
Phenomenal group.
Always.
I so love my time there with them. And it just getting to know you, Francois, this last couple of years has been one of the highlights of my career. And just watching what you're doing now there in Africa is definitely one of the highlights of my career. So thank you so much for being with us today. Are there any parting thoughts or parting words that you want to share with our audience before we end this conversation?
Oh, thank you. Thank you so much. And I would say thank you, Victor, for inviting me over. And as I said, this is my first time on the podcast. So it's a good experience to just discuss as we're discussing. And it speaks to me. It opens my mind. And I believe that the audience too is getting something that is edifying. And we loved your presence in Cameroon and involvement of AFSP and what has been doing. So you can come around anytime. We'll be happy to welcome you and to make you maybe the chief of a certain village. And Vera can come with you. And any other. Yeah. So thank you so much. One of the things that I would like to leave us with is the need to think about about this fight as a public health issue and as a global issue. Yeah, there's no Africa, there's no America, there's no Asia as far as this is concerned. This is something that has to do with the whole humanity. And the more time is going, the more the world is being traumatized by so many things. The stress is increasing, anxiety is increasing, and more of such struggles will be all over the world. And so I will say to the audience that we as individuals should look at this not only as a public health issue, but as a global issue and feel concerned about what might be happening anywhere else. And of course, to those like the FSP and any other organization or any other group that's already involved in it, to also consider the need to make it global. I will still point out, we need resources. We need resources to be able to do this work in Africa, and we will be encouraged. We will be happy to welcome any resources that can be made available to help the work, as I said, as part of the global struggle and the global fight about this struggle. So that's what I will want to leave the audience. Let's do this
Thank
together.
you. Yeah, thank you so much. I think that those no final words to end this conversation on. So I want to thank you, my friend, my brother, Dr. François Tchidjé, for being with us today in this conversation. Thank you to everyone who joined us today to be a part of this conversation. And to anyone out there, if you are struggling, if you live with mental health challenges, get support. And if you're in crisis, reach out for help. Know that you matter, your life matters, your pain matters. You are not alone. And we want you to be here tomorrow and every day after that. Thank you for joining us on Strong Talk.
Thank you.